We now bring you a Long Island woman who took it upon herself to research what could happen when she had reconstructive surgery after a mastectomy. And she uncovered a life-changing technique performed right here at Northwell Health at Glen Cove Hospital.
Hi, Mary. How are you? You good?
I'm good. I'm doing well.
Mary Leonardi is a pioneer among breast cancer reconstruction patients.
And your range of motion coming up is great? Okay, good. And what about on this side? Okay, great. Okay, good.
In the skilled hands of Dr. Tanna, Mary became the first woman on Long Island to undergo a new robotic procedure to reconstruct her breasts after a double mastectomy.
I like the opportunity to be part of additional choices for women, to have as many choices available if and when this is something you're forced to think about. Makes me feel like my journey is very worth what I've been through.
In June, Mary underwent deep flap surgery, a technique that reconstructs the breast by using a patient's harvested tissue.
A flap is taking tissue based on a blood vessel and transferring it from one area of excess to build the breast. We look most commonly at the abdomen as the source of that extra skin and fat. The DIEP flap is the most common technique for flap reconstruction because it's widely available.
What was uncommon about Mary's surgery was the use of a robotic system during the procedure. The robotic method minimizes the size of the incision in the abdomen, reduces scarring, and cuts down on recovery time.
The robotic technique really represents the latest innovation and improvement to the technique. In a traditional DIEP flap reconstruction, you're opening up that rectus abdominis muscle for 8, 10, 12 centimeters. And with a robotic DIEP flap, you really are only disrupting it for 2, 3 centimeters.
I was discharged 2 days after. I was walking the next day. I was really pleasantly surprised in the lack of incision pain and wound and pain issues. I noticed myself walking upright by the first week post-op, which also was an unexpected and happy surprise. This is a complete credit to the robotic method. I wouldn't have done this really any other way.
In fact, Mary requested the robotic deep flap technique after doing extensive research about the new method. She urged Dr. Tanna to perform it for the very first time, and he agreed. He assembled a team of surgeons to assist him, including Dr. Jesse Selber, a plastic surgeon in Texas who pioneered the procedure.
We really put together the best of the best to be involved in Mary's case because we wanted to make sure that she felt comfortable, that while it was our first time, she would have a safe and reliable outcome. We knew that if we do this right, this could potentially open the doors to women, all across this region.
And that is exactly what's happened. Because of the success of Mary's procedure, Dr. Tanna and his team are now regularly performing robotic deep flap surgery.
It's our patients that inspire us. It's our patients that push us to be better, and Mary exemplifies that. She really pushed us out of our comfort zone and really forced us to push science and innovation forward. And by doing so, she's paying it forward to the other women that are going to benefit from this technique.
I'm thrilled that other women have this choice. It was very important to me to add more tools to our choice list if and when the unfortunate event occurs that we have to think about, something like mastectomy. This opens the door for more women to not feel pressured to have to do an implant method if that's what they were only offered previously. I do feel like a woman really has to be her best advocate, but I also feel we're blessed. We're in a generation where information abounds at our fingertips for us to learn and be an empowered patient.